All right, we are back with Grazel Garcia from GGPA, and today we're going to be talking about is it okay to go back to your old therapist? Because very often therapy reaches a natural conclusion, or maybe someone just drops out of sessions, they get 6 to 12 months down the line, and they think, oh, I really need to come back. But then there's a bit of awkwardness because, is it okay to go back to them? Are they going to be angry with me? What do you think, Grace? Are you ever annoyed when someone comes back to you after a break?
No, I love it when they come back. Um, and I can definitely understand the point that you're making where, patients will feel afraid that the therapist will have a certain feeling about them leaving and not continuing therapy and then now coming back for support. Yeah. Um, I love for when they come back.
So, what sort of reasons would they come back?
Some patients, don't like to do long-term therapy, so sometimes they're only interested in short-term therapy and dealing with the current situation they're having. And once they feel better about that, they don't like to stay in long-term therapy to dig deeper. So that's completely fine. It really depends on what they need. And if I'm able to provide that and they feel better after that, they can leave and do short-term therapy. And then, once short-term therapy is done, I always talk about if you ever need to come back, I'm always here, right? So long as our schedules align, the only problem that I get is that I don't have much opening. So when they come back, it can take a while for me to put them back in my schedule.
Yeah.
But most of my patients come back. Um, and yeah, so some patients do short term and they take a break and then they come back.
Okay. Are there any other reasons why someone might leave apart from they feel like they've got everything that they need out of therapy?
If I know the reason, when they tell me, it could be financial reasons, it could be
Hmm.
that they're moving, it could be that they don't have time for therapy right now, or they've gotten what they needed.
Hmm.
Sometimes, unfortunately, some patients don't share why they're leaving. And most of the time, those patients don't come back if they don't share.
Yeah.
And that's not necessarily a bad thing. They probably just don't know how to share what's coming up for them, and it's better for them to share it with a new therapist.
Yeah.
But I highly encourage that they share so that they can work on it.
Yeah. And when someone comes back to you or comes back to any therapist, are there occasions where that can complicate things because you've got this past relationship with them, or is it a good thing because you've got that past relationship?
I don't see it as a negative. I think it's a positive where there's already a built relationship between the therapist and the patient. The patient feels better when the therapist already knows about them, so they don't have to go and introduce themselves again, introduce their history, what they're going through,
Hmm.
what they're struggling with. So there's also trust and safety. Um, in the relationship embedded already. So it's always better.
Yeah. Okay. How is it on your end? Say, obviously, you see lots of people a week. If someone drops out for 12 months, say, and then comes back to you, do you have a lot of legwork to do to remember where they were at? Do you have to go through all of your notes and spend 2 hours going through that?
Mm, not necessarily, but if I saw a patient for maybe only a few sessions and they
Mm.
stopped, I don't have a good understanding of who they are.
Mm.
So it didn't give, the short time that I had with them didn't give me an opportunity to really get to know them. So I might have to start over.
Mm.
But most of my patients have been with me for a long time. So I do know them. I understand. I don't have to go back to my notes to trigger my memory. I know I know them. I know their identity for profile. I know their their struggle points. The only thing I wouldn't know about is what they're coming back for.
Yeah.
Yeah.
And when they come back, do you ever notice that they seem like a different person?
Um, Before they leave, I
Mm.
already see that they're a different person, meaning
Yeah.
they're better. So
Yeah.
when they come back, it's they're better and they're just probably struggling with something new.
Yeah. Okay. I was just wondering, sometimes when they come back, maybe it's that short-term therapy situation where they had something acute going on, you've dealt with it, they've gone away for a while, they've come back and they've their emotional state has kind of gone through the floor because they haven't actually done that deep inner work. Do you ever find that happen?
Yes. Yeah, if they haven't really done the inner work because we didn't get enough time
Hmm.
together, they usually stay the same.
Yeah.
So when they come back, it's the same way they left, how they were when they left.
Hmm.
So we need to go deeper. And sometimes, what I've noticed, I mean, this doesn't happen with me a lot, but maybe a couple of patients where over the course of my work, um, if it's their first time in therapy, they'll try it out for a few sessions, they'll stop, they'll come back in 6 months, they'll try it out again for several more sessions, they'll stop. And then by the third time they come back, they stay for
Yeah.
a long time.
Yeah.
Yeah.
That's interesting.
I've seen that kind of pattern where they're testing to see how they feel about the therapist. They're testing how they feel about in therapy, um, about being in therapy, and then they're testing to see kind of how deeper they can go in therapy. And the more comfortable they feel, the longer they stay.
Yeah. And it's really interesting because obviously therapist fit is a really important thing in terms of the therapist client relationship. And sometimes clients have to test out a few different therapists to find the right fit. But at the same time, you don't want to just walk away from a therapist relationship before you've given it a chance to really kind of flourish and get grounded and make sure that you've got that relationship there to build on. Um, so how can you tell when maybe the fit just isn't there and you think, actually, no, I do need to look for someone new, versus actually, no, I can stay with this person?
Great question. I mean, therapists do this too. If I think it's an important thing to keep in mind that there are therapists that's going to be a fit for you, and there are therapists that's not going to be a fit for you, and vice versa.
Mm-hmm.
There's going to be patients not going to be a fit for me,
Mm-hmm.
and that's okay. So if they're not a fit for me, it's usually because maybe my specialty or I don't have a specialty in an area that they're looking help with.
Mm-hmm.
And that means I'm going to have to refer them out.
Mm-hmm.
Sometimes, you know, like for me, I'm looking for a patient that's committed to long-term therapy
Mm-hmm.
because there's so much that you need to do to get to that place of self-actualization.
Mm-hmm.
And that takes work, a long time. So if the patient is just looking for short-term therapy and CBT, I'm not the right therapist for them. And
Yeah.
they're not, and they're not going to be the right patient for me. So I tell them right off the bat, if you're looking for a therapist that's going to do CBT with you, that's not me.
Mm-hmm.
I'm going to refer you out to someone that does, that you're going to feel like a good match with.
Yeah. And it's really interesting to understand the different specialities that different therapists offer because you just think, well, they're a therapist, they can do whatever, but it's sometimes it's very much the difference between like a plumber and an electrician in terms of how they work and what they deal with. Um,
Exactly.
Yeah,
Right, exactly. You're looking for general medicine, okay, you can go to a general practitioner. But if you're looking for fertility issues, then you need to see a fertility doctor.
yeah, exactly.
Yeah.
Um, so if someone's in that position of they're not sure whether they should get back in touch with a therapist they've seen before, what sort of things do they need to consider before actually reaching out to them?
Scheduling,
Hmm.
uh, if the therapist has an opening, if the therapist's fees are still the same, because if you take a break, let's say you saw your therapist and you had a rate that was a lot lower. If you take a break for 2 years and you come back, it's you need to expect that the therapist rate is probably different by then.
Yeah.
And you may not be able to afford it,
Hmm.
depending on where you're at financially. So that's an important thing to consider, like more logistics. Um, but I think other than that, that's pretty much it.
Yeah.
I mean, if you've already had a rapport and embedded health, like trust and safety with the previous therapist, that brings you back.
Yeah.
You don't question, right?
And if you don't have those things, then that's an indication you shouldn't go back to them and you should find someone else. Yeah.
Yeah. And if the patient wants something different, um, I think it's good to always see a different therapist sometimes, because the patient can learn so many things from different therapists. We have different approaches. We have different ways of delivering a message and delivering our services. So it could be that we're doing the same type of specialty, but you may like the other person's way of speaking, and and that's okay.
Yeah.
That's completely okay. As it's important that you have a good match
Yeah.
because that makes it easier to be vulnerable.
Yeah. Absolutely. Well, yeah, thank you so much. I hope that's kind of put people's minds at rest a little bit that it is okay to go back to your, to someone that you've seen before and that they're not going to be mad at you. So yeah, if you're in that situation, don't be afraid to reach out again as long as it felt right when you were seeing them before. Um, yeah, thanks so much for your time,
Yeah.
Grazel. Speak again soon.
Okay. Thanks, Scott.